Good morning. My name is Stephanie Burrows and this is my presentation on health promotion, showcasing how models and organisations aid in promoting public health. What is health promotion? Health promotion is a process of enabling an individual to improve their health and therefore their quality of life, but it also aids in helping a person to have more control over their lives. The main focus of health promotion is using different models to encourage good habits through social and environmental interventions with health professionals and organisations. There are many different model approaches which will be discussed in the upcoming slides. The different models which aid health promotion. There are many different models which aid medical professionals in ensuring the best possible outcome for patients in regards. These include the social model, socio-ecological model, the health belief model, the social cognitive theory, and finally, the stages of change model. We will look into these models in more detail in the upcoming slides, starting with social model. Health is not determined by just simply physiological changes, but a broad range of factors, including social relationships, economic stability, cultural and political factors, and a person's ability to have access to the healthcare. We will look into these. Using a social model of health ensures that health professionals consider these key factors which have an impact on a person or community, and so involve these communities in planning solutions to health inequalities. Socio-ecological model. The socio-ecological model builds on the social model and places emphasis on the impact of an individual's environment and the desire to understand the relationship between personal and environmental factors. Urie Bronfenbrenner developed the theory where he looked at the interplay between 5 environmental factors to aid the medical professionals to focus on specific behaviours with multiple factors. These factors include public policy, national and territorial local laws and policies, community, designing access and spaces for well-being, organisational, organisations, schools and workplaces, interpersonal, family, friends and social networks, and finally, individual, a person's knowledge, skills and attitudes towards life. The health belief model. Social psychologists developed a theory in the 1950s with the aim to be able to explain and predict the health behaviours of individuals. A person's severity of potential disease and susceptibility can be impacted by modifying behaviours such as demographically and sociologically. Examples of these include: if a person feels threatened by a particular condition, they may change their attitude towards their health and take action to prevent the condition. A person is unlikely to take action if they are at low risk. If a person feels they are at lower risk, they are unlikely to take action in changing their healthcare, and they may believe changing is less beneficial to keeping things the same. Moving on to social cognitive theory. Social cognitive theory focuses on the observational learning of individuals. There is a deterministic relationship between the individual, environment, and behaviours. Modelling is an integral part of social cognitive theory, as it states that when an individual witnesses a behaviour and consequence, they will memorise it and use it to guide future behaviours. It refers to the belief that a person can perform and carry out behaviour within their ability. And moving on to the stages of change model. The 6-stage change is often used to support alcoholics to overcome their addiction. If an individual can comprehend the readiness to change, then it can be used to support them to develop the right course of action. The 6 stages include pre-contemplation, the first thoughts of changing their behaviours. Contemplation, serious thoughts of change. Preparation and determination, preparation to take action to change their behaviours. Action, taking that action. Maintenance, maintaining the action taken. And relapse and determination, either relapsing or having to start again, or termination of the addiction and behaviour completely changed. We're going to compare 2 models in health promotion, the health belief model and the stages of change model. Making a comparison between the health belief model and the stages of change model, there are a few similarities between the two, such as both models emphasising the importance of behaviour change in promoting health and preventing disease. They both acknowledge the role of social and physical environments which help to shape behaviours. And they highlight the need for intervention that tailors the personal needs and readiness to change. Differences. There are differences between the 2 models, however. Both models are based on different theoretical frameworks and concepts, which leads to variations in how they approach health promotion. The 2 models also prioritise different constructs, such as susceptibility in health belief and self-efficiency in the stages of change model. Some models focus more on individual factors and others will consider broader social and environmental determinants. Talking about the effectiveness of models in promoting health. When a model is implemented correctly, it can promote positive health behaviours and can be effective in improving the public's well-being. There are a few key factors to consider when choosing the correct model for each individual. Evidence-based. Models have been tested and validated through research and are more likely to be effective in promoting health behaviours. Tailored approaches are good for targeting the population for their specific needs and characteristics, promoting better outcomes. Behaviour change techniques. Techniques in behaviour changes includes goal setting, self-monitoring, and initiatives, and incentives. Sustainability. It's important to maintain rather than finding short-term fixes. Long-term behaviour changes are more likely to lead to lasting improvements. Evaluation determines the effectiveness of health promotion models and allows for continuous improvement based on feedback and data. The next slides that we're going to see is talking about the Change for Life initiative. When promoting health, initiatives were introduced to help the public health. Change for Life was launched in 2009 in England. It was a social marketing programme aimed at combating obesity and the implemented health issues attached to it. Change for Life was aimed at families as an interactive, fun way of making healthier choices together. The 4 stages of Change for Life campaign. The purpose of the Change for Life campaign is split into 4 stages. Alert. Educating families on the dangers of excessive sugar consumption. Motivate. Educate families on the different dangers of excessive bad eating and personalise it to specific families. Support. Encouraging them to download the Sugar Smart app and providing free assistance on how to work the app. And finally, sustain. Encourage parents to buy fewer high sugar content foods such as sugary drinks or juices or chocolate, ensuring children eat less sugar in their diet. The aims and objectives of Change for Life. The main aims and objective of Change for Life include 5 a day. Suggestions were offered to families for ways to eat 5 portions of fruit and vegetables a day. 400, 600, 600. Advice on watching calorie intake throughout the day, with 400 calories for breakfast and 600 for lunch and 600 for dinner. Watch the salt. Raising the awareness of too much salt intake and encouraging reduction of amount eaten each day. Cut back fat. Information about good and bad fats and how to reduce the bad ones in a family's diet. Sugar swaps. Raising awareness on how much sugar is found in foods and sugary drinks and good food alternatives to reduce the sugar intake. 100-calorie snacks. Snacks are welcome in a family's diet, but it is encouraged to keep them to 100 calories or less. And finally, get moving every day, emphasising the importance of leading an active life and offering suggestions on how to get a family moving. The effectiveness of Change for Life. The Change for Life brand grew quickly, and responses to it were, and still are, overwhelmingly positive, with 400,000 families joining the campaign within the first year, and over 1 million other families claiming the campaign had a direct impact on their family's behaviour towards a healthy lifestyle. We're finally going to be moving on to organisations which contribute to improving public health. The organisation I will be talking about is the National Institute for Health and Care Excellence. They develop guidelines and recommendations for healthcare professionals and the public on the most effective ways to prevent, diagnose and treat health conditions. These guidelines mainly aim to help ensure consistent, evidence-based healthcare across the UK. The organisation conducts research to identify health trends, assess the effectiveness of interventions, and provide evidence-based recommendations to contribute towards improving the public health, as well as providing valuable information and resources to educate the public on health risks, preventative measures, and a healthy lifestyle. Thank you for listening to my presentation on promoting health, with discussions on different health models to improve the public health, along with the Change for Life initiative and the National Institute of Health and Care Excellence organisation. Here is my reference list. Thank you again. Thank you for listening.